Hi, this is Josh Marshall from TPM. This is the setup for Monday, July 2nd, 2012, and today we're talking about the aftermath of the Affordable Care Act decision from the Supreme Court and whether Barack Obama could have got something better. Everybody today is still getting over the big surprise from the Supreme Court last Thursday. Everybody seemingly had expected the court to strike down either the mandate from what's now called Obamacare by many or the law altogether. So it was a big surprise when Justice Roberts joined a 5-4 majority to uphold the law. Now, I can't help mentioning that our reporter, Brian Beutler, was one of the few to actually see this coming at the oral arguments a couple months ago, so check out his article. Now, over the weekend, some liberals who are supporters of single-payer healthcare reform are back to saying that the Affordable Care Act is basically going to be an albatross around President Obama's neck and, frankly, the Democrats' neck, because it's going to fall apart, it's not going to work, and that really the only solution to the country's healthcare woes is some version of single-payer. And this is basically what most other industrialized countries around the world have. The best way to think of it in American terms is Medicare for all. Now, I don't have a crystal ball, but purely in the policy terms, there's a pretty good argument that they're right, that single payer really is the best approach to healthcare reform. Frankly, that's why, again, pretty much every other industrialized country in the world has some form of it. You get better cost containment, you get better efficiencies, you get better coverage for everybody in the country, and frankly, you probably get better care. But was it possible? I would say not even close, and I think it's another example of the typical liberal delusion of chasing after defeats when half a loaf wins are right there for the taking. Remember, there was something called the public option, which would sort of be a mini single-payer plan within the Affordable Care Act. This was supported by progressives pretty much across the board, but it simply could not get pushed through. President Obama, it seems pretty clearly, decided it wasn't possible and didn't actively push for it, but when it was pushed for in the Senate, they couldn't get anywhere near the 60 votes that they needed and probably wouldn't even have been able to get 50 votes. So to think of this in loaf of bread terms, President Obama and the Democrats tried to get a tenth of a loaf and hit an absolute brick wall, not just from Republicans, but from centrist and conservative Democrats. So the idea is that where they failed getting a tenth of a loaf, they should have somehow tried to get the whole loaf, and that would have been remotely possible. Not even close. Now, a lot of progressive opponents of the Affordable Care Act say the big issue was the money of the health insurance industry. And it's true, the health insurance industry played a big part in killing the public option. But it's not just about money from the healthcare insurance industry. No, the single biggest obstacle to getting single-payer healthcare in this country is the product of a series of historical accidents. It's how the nation's healthcare system came into being in the 40s and 50s. And very specifically, the obstacle is this. Most middle-class families, certainly most upper-middle-class families, have health care insurance. They may complain about it, they may not like their insurance company, but they have it, and they're very, very reluctant to give it up for something that is unknown. Now, single-payer advocates may think that when they had it, that these people would like it even better than their current system, and I think there's a good chance that they'd be right. But trust us, it'll be awesome is just not a good political slogan when you're talking to people who are very risk-averse for changing how their families get health care. Does this mean people shouldn't keep advocating for single-payer? Of course not. And could single-payer evolve out of the Affordable Care Act system? Yeah, it totally could in a variety of different ways, especially as the employer-based healthcare system continues to deteriorate. But I want to throw some cold water on this idea that President Obama could have got something different or better if he just put his mind to it. That's just not the case. And you just have to look back at the actual political realities back in 2009 rather than going off and hunting unicorns because it feels good inside to do so. I'm sure we'll be talking about this a lot more over the coming week. I'm Josh Marshall from TPM, and we'll talk to you next week.